Hey everyone, and welcome to The Explainer. Today, we're taking a guided tour of one of the most complex and honestly, one of the most important systems in your entire body, your gut. It's a wild ride, so let's jump right in.
Think about it. Your digestive tract is this incredible 30-foot-long powerhouse that fuels everything you do. But it's also a really delicate ecosystem. So what happens when that careful balance gets thrown off? What happens when things go wrong?
So here's our game plan. We'll kick things off with a quick tour of the gut itself. Then we're going to look at what happens when acid decides to fight back, when there are breaches in the body's walls, and when a whole system just goes up in flames. After that, we'll see what happens when the crucial support organs falter. And finally, we'll talk about what's next. How do we find relief?
Okay, so let's start our tour. The gastrointestinal system, or GI system, is basically one long winding tube that connects your mouth to, well, the other end. And its whole purpose is to be this amazing pathway that breaks down everything we eat and pulls out all the good stuff, the nutrients that power our lives.
Our first major stop is going to explore what happens when one of the system's most powerful tools, that super strong stomach acid, turns against the very walls it's supposed to protect. And when that happens, you get something called a peptic ulcer. It's really just an open sore and erosion that forms on the lining of your gut. And it happens when that digestive acid literally starts eating away at the tissue that it's meant to be working inside of. Now, what's interesting is you can often tell the two main types of ulcers apart just by how they act. Gastric ulcers, the ones in your stomach, they tend to hurt right after you eat. But duodenal ulcers, which are just past the stomach, cause pain a couple of hours later, sometimes even waking you up in the middle of the night. And get this, there's this weird little medical curiosity where they seem to be linked to blood types. We're still figuring out exactly why. And when it comes to how common they are, it's not even close. Duodenal ulcers make up the vast majority of cases. We're talking 80%. Gastric ulcers are much, much less frequent, coming in at around 15%. So what's causing all this? Well, it's almost never just one thing. It's usually a perfect storm of factors that weaken the gut's natural defenses. The two biggest culprits are the H. pylori bacteria and the overuse of NSAIDs. Non-steroidal anti-inflammatory drugs like ibuprofen. Those can wear down the stomach's protective mucus. And, of course, lifestyle stuff like stress and alcohol definitely don't help. All right, let's move on. We've talked about chemical problems, but now we're going to shift to physical ones. This is about what happens when there's a literal breach, a breakdown in the wall that's supposed to contain all of our organs. And that brings us to hernias. The best way to picture it is like a weak spot on a tire that starts to bulge out. An organ or some tissue literally pushes through a weak point in the muscle wall that's supposed to be holding it all together. These can happen in a few different places. The most common is down in the groin, but you can also get them where the stomach pushes up into the chest, or even at the site of an old surgical scar. Now, a hernia gets really dangerous when it becomes strangulated. This is when that little bit of tissue that's poking through gets trapped and pinched so tightly that its blood supply gets cut off. And that right there is a true medical emergency that needs surgery fast. And a breach like that, or from something like a burst ulcer, can kick off this really dangerous domino effect called peritonitis. It starts with a leak from an organ. That causes the lining of your abdomen to get inflamed. Then comes infection. And from there, you're at risk of system-wide sepsis, which is absolutely life-threatening. Okay, next up, we're looking at a condition where the problem isn't some outside invader or a physical hole. This is where an organ turns its own incredible power against itself. It's a system on fire. This is pancreatitis. So your pancreas makes these super potent digestive enzymes. Normally, they don't get activated until they're safely in your small intestine. But in pancreatitis, they switch on inside the pancreas, and the organ literally begins to digest itself. Yeah, you heard that right. Autodigestion. It's as painful as it sounds. So what sets this off? A lot of the time, it's actually tied to other GI problems. Gallstones can create a blockage that causes everything to back up. Heavy, chronic alcohol use